Okay, let's go ahead and kick off our training with a general overview of Lone Star Script Care and the program that they offer. They are a nonprofit patient advocacy agency, and they specialize in prescription assistance programs. So, what is a patient assistance program? Well, let me go ahead and read it right off of here. They're usually sponsored by pharmaceutical companies and provide free or discounted medicines to those who cannot afford their prescriptions, the uninsured, and underinsured people who meet the guidelines. Eligibility and application requirements vary from program to program. The ever-changing requirements in the application process to qualify for patient assistance programs are tedious, confusing, and very time-consuming. At Lone Star Script Care, they've found that some people might have difficulty navigating the application process and need help. You may contact drug manufacturers directly to find out more about specific patient assistance programs. So let's simplify this. These patient assistance programs have been around for a while, and anyone can submit paperwork and apply. They can do this for free. However, the application can be intimidating, confusing. You might not know where to send it. You might wait forever with no response, and a number of other things. So Lone Star is a service company. They take the process and they make it easy for the client. Is free better? Well, you get what you pay for. When you can save someone over $100 a month after they have paid the modest service fee, and they know their file will be up to date, that's where the value comes in. Alright, so let's go ahead and take a look at some very important bullet points. This program provides drugs at no cost or little cost per prescription. Most drug manufacturers sponsor this program, and these next few points are extremely important. This will be the most important part of your training, actually. This program helps those that spend over $50 per month on prescriptions and earn less than $60,000 a year of household income, or $30,000 per year for individual. It's not based on medical history, it's not based on age, and the program is not insurance. And it's just a service-based program. Now, stressing why this is important, your clients and yourself are going to be asking a million questions, a lot of scenarios. I have Medicare Part D, I have insurance through work, I have a discount card, I have something special, insurance that I have that, helps me with my prescriptions. What's important is that this is an independent program of all that, and it works with all of that. So there's nothing that anyone can say that will disqualify them from the program other than if they don't spend $50 a month on prescriptions and they make $100,000 a year or something. So it's really important to keep that in mind because the simplicity of the program is really the key. And hopefully I've answered all those questions, but you're still going to ask, and your clients are still going to ask. But that's one of the most amazing things about the program is that it doesn't matter what else you have, this will work with it. So it's very simple, and it's just important that you realize that because I think when agents overcomplicate things, that's when they struggle. So just want to stress again, the qualifications are very, very, very lenient here. With such a large potential customer base, you should have no problem finding clients. In fact, this is something they want and need. Now, we'll cover specific marketing strategies later. All right, so let's go ahead and take a look at a few more program highlights. So, what does Lone Star do? Well, they complete all administrative actions and applications. That means they're going to take those long forms and intimidating applications, and they're going to handle all that in the back office, and the client is never going to have to see it or deal with it. Get your doctor's verification. Now that is key. They are going to send via fax or mail a sign-off form for the prescribing physician. And that also gives credibility to the sale because you can let your client know that, of course, your doctor is involved with this. We work with your doctor. Patient-client completes one application only. This is also important. It's a very easy application, probably the easiest you've ever filled out before. Very streamlined, hassle-free application process. Also important, there's no long waits, there's no underwriting involved. Pretty much when you submit the application, the business is submitted. Think of it this way: why use an accountant for your taxes or a realtor to sell your home? Basically, that's some sales tactics there. If a client were to say, well, if this is something I can do for free, then why don't I just go ahead and do it? Well, if you're spending over $200 a month in medications and I can provide them to you for $30 and give you a very streamlined experience, it's no hassle for you, I'm saving you $170, that's pretty much where the value is. More analogies, if you can go to court and represent yourself, but of course you're going to hire a lawyer. You can change your own oil, but you usually go and get a mechanic to do it for you. So, if you had any sales experience, you can kind of say these things, and really, when someone sees how much you can save them, they really shouldn't be excited to go figure out all this on their own. They should be excited to let you do all the work, and they just pay a small monthly fee. Okay, as far as our guarantee, if you receive no medication and are determined to be ineligible for patient assistance programs by all applicable drug manufacturers, we will gladly refund your monthly membership fee. All we need from you is a copy of the letter sent to you from the applicable prescription drug manufacturers explaining why you're ineligible. In the application portion, I will go more into detail about refunds, but for now, just know that the $25 application fee is non-refundable in almost all cases. If Lone Star cannot get them approved for their meds, then they will refund the monthly service fee. If the medication stops from being available, then Lone Star will refund the monthly fee if the client provides a copy of the letter from the drug manufacturer. If the client chooses to cancel, then they can and must do so in writing. Lone Star will not issue any refunds, but of course will stop servicing the client. Alright, so cost to the client. This section will be very easy to grasp. Basically, Lone Star Script Care has a very easy to understand monthly fee structure. As you can see highlighted in the yellow, if you're helping a client get 1 to 3 medications, it's $30 a month. 4 to 5 would be $40 a month. 6 to 7 medications would be $50 a month. And anything 8 and over would be $60 per month. Real quick, let me just say that it doesn't matter how expensive the medication is, that's the flat price. So, a new agent, you might come along and think, well, what if it's a really super expensive medication? What if it's one that's like $260 or something? Does that mean that just that one medication would be the $40 a month? No. No, it really is as simple as it looks. Regardless of how expensive the medication is, the monthly fee structure is based on the number of medications, not the cost of the medication. Also, there is that one-time application fee of $25. As I mentioned before, that's in most cases non-refundable. Every client pays that, so that is present. Keep in mind, clients do not pay us for their medications. They pay us to complete a service for them. They will be billed upon submission of the application to our office and monthly once approved for a minimum of 1 medication. Refunds are only given in the rare instance that we are unable to assist them in obtaining their medications. That part about being billed monthly once approved for a minimum of 1 medication, it's important to know that it can take 4 to 6 weeks for them to get their medication. Please take note of this important point right now, that this isn't something that happens immediately. When you sign up a client, you can't say, okay, I've got you signed up, we'll have your meds to you next week. You should advise them to not change anything right away until they get their medications from us, which could be 30 to 90 days, 4 to 6 weeks. Also important to note is that along with their application fee, they are charged the first monthly service fee, but that monthly service fee is not charged again unless they are approved. So, Mrs. Smith that you sign up, that's paid her $30. In 30 days, if we haven't approved her for her medications and she's not going to receive them, she won't be charged again. That's really important to know, okay? So moving on to the actual list of medications, it's quite extensive, as you can see here. There's over 1,800, I believe, on this list. This is 24 pages long. What I do is I print it, two-sided, so it's 12 pages. I have it in a small binder, and I just take it to the home with me. If you have a tablet or a smartphone and you wanted to have it on there, that's easy as well. You can do a quick search, and there's a ton of medications on here. Usually when a client needs help, I have not run into a client yet that doesn't have at least 1 or 2 that are on this list for sure. So this is very extensive, very easy to follow. If a client mentions a medication that is not on this list, you do have the ability to go to the medication verification section. Under your own back portal, you'll notice that under information, it'll say verify medication. And this is very easy to navigate. Just put in your information, put in the prescription, and they will respond to you within 24 hours to let you know if a medication is available. So that's nice too. The list is pretty complete, but if you have any questions, you can just fill this form out and get a definitive answer on that medication that you don't recognize or see on the list. One more thing here to look at as an example. Um, you know, a little bit of thought process goes into signing someone up. In this example, Mrs. Smith is on 5 medications. Now, as you see here, we can total these together, and you're going to come up to $64 for 5 medications. Now, you're probably thinking, oh, well, that's easy. I'm going to go ahead and sign her up for the 5 medications that cost $40 per month. But that might not necessarily be true now. Take the first 3 medications and get those for her, the most 3 expensive, for $30. And then you have $9 remaining. That's $39, not $40. And most importantly, her medications number 4 and 5, she is probably able to get pretty easily at $7 and $2. She probably goes to her local pharmacy and she gets it, and it's no hassle. So really, it's the best thing to do for the client to submit all 5 of her medications and have all 5 of them in our program. Not necessarily. You can get her the first 3, which are the most expensive, all for $30, and let her keep the other 2 the way they are, so they're not part of the process, and she's still, spending $1 less than she would be going with us for a 5 prescription sign up. So, all those scenarios, you just really got to think about. What I like to do when I do a sale or when I'm consulting a client is ask, what are your top medications price-wise, and make the list and go from there. They will generally have a lot of $2 or $3 medications, and really those probably aren't something you need to mess with. That probably would be a negative thing to mess with those less expensive medications. So try to focus on the bigger items, and that's just a good sales tactic, and also it's just smart for the client. Okay, so that will complete our pricing structure for clients. Alright, so let's go ahead and talk about the most important part, commissions. Lone Star has a very easy commission schedule to follow. Each new enrollment you submit will get you a $25 commission. You also have weekly bonuses you can shoot for. So if you sign up 4 to 7 new clients every week, you're going to get $5 additional per enrollment. If you sign up 8 or more, you're going to receive $15 additional per enrollment. So to put that simply, you should always shoot for at least 10 a week and receive $400 in commissions. Let's go down to the most powerful part of Lone Star's commission schedule, though. That would be the recurring commissions, or the salary. Basically, you should get to 25 active enrollments pretty quickly. And when you do so, you're going to receive a monthly recurring commission of $375. So all you have to do is maintain the 25, which will not be too hard because these are people's medications we're talking about, and it's rare for someone to cancel getting their medications. So basically, you have 25 active enrollments. You receive $375 every month. If someone does drop off and you have 24, then you're no longer receiving that $375 monthly. However, it shouldn't take much effort to go ahead and get one more on there. Now, you can go down to 300 active enrollments and receive, $4,166 a month, which is a annualized salary of $60,000 a year. You can go even beyond that. It's basically never ending. As far as payments go on your commissions, whatever you submit that week, you'll repay the next Friday via direct deposit. And keep in mind that does take 1 to 2 business days to go directly into your account. Your back office is great because it will show all your clients, show everyone who's active. You can search all your commission history. Everything's there. It's very easy. It's very nice looking system. So basically, that's the commission schedule. It's not too hard to follow. Your main goal should be to get to your number of active enrollments to the point where you're receiving a salary, because you're also receiving your commissions for your signups every week as well. So they go hand in hand. If you have 150 active enrollments, you know that every month you're going to receive your $2,250. And that month, if you were to go ahead and sign up 10 for a week, you're also going to receive your $400 every week as well. So they work together, which is great. Also keep in mind that the salaries are paid on the 15th of every month. And let's say that on the 20th of the month, you have gone from 150 to 175. Well, in that case, you will be receiving the next bump up, the 2006-25. But it doesn't happen in the middle. So let's say that you are set for the 150 active enrollments, but on the 13th you bumped it to 175. Well, on the 15th you're still going to receive your 2,250. It won't be until the next month that you receive your 2006-25. So I just want to clarify there, so you know that it's not instant. It is month to month. So you always want to take your month, increase your active enrollment, so you can always look forward to a new monthly check that's higher every other month. So basically, that's how the commissions work. Very simple. If you have any questions, feel free to email me. But I think everyone can grasp this pretty easily. So let's go ahead and look at the sales process here. We'll go over it from start to finish. Let me just go ahead and say up front that it is a very easy process for an agent to make a sale and submit business. You see 12 steps in front of you here, but really we only do 4 of those. Most of the work is done by Lone Star in their back office. So I just want you to know that going forward, this is a very, very easy stuff here. Step 1, 2, and 3, that's just the sale. You know, how you do that is up to you. Receiving calls, making calls, referrals from friends. That varies, so we're not going to go over exactly the process, but that's just your basics. You're actually making the sale. You're presenting the program, and you're seeing if someone's interested in going forward. That leads you to step 4, which is completing an application, which we're going to go over. Also very, very simple. Then step 5 and 6 actually no longer apply. That's about faxing in an application or mailing in an application. We no longer do that. It's all done electronically, so you don't have to worry about that. So step 7 through 12, that's all Lone Star. They handle everything from here. They call the client. They review the app. They're going to send a welcome kit. The patient's going to send forms to the physician. Actually, we send the forms now. The physician returns the applications. Everything's signed off. Everything's checked. And then all that's sent to the manufacturer so they can receive their medications. So basically, the entire process, we are a small part of it. We make the sale. It's very quick. The application is very quick. And then all the back-end work is done by Lone Star. So a lot of agents ask me, well, what do we do? What happens after the sale? Do we need to deliver the policy? Do we need to send them anything, fax them anything, or are we in charge of this or that? So let me just just kind of stress here that you don't have to do anything. As an agent, it's just very simple. You sign them up, easy application, and then they're all set to go. The application process itself and submitting business is also very, very simple. So here on the website, we'll do the most common way to submit business. Let's say you are on the phone with someone, or let's say you have your laptop and you have internet access and you want to go ahead and just submit business right away. Well, you're on your main site and you go down to the bottom and it says apply. Click on that, and as you can see, you have basically an order form here. You have the $25 one-time submission or enrollment fee, and then you have your monthly fee based on the amount of prescriptions, which you would alter depending on how many they have. You just add it like you're adding to a cart here. You check out, and as you can see, there's very basic information: their name, address, city, social, date of birth, gender, all that. So very basic stuff there at the top. And then as you go down, you have your patient questions. So you're going to ask their marriage, how many in the household, income level, do they currently have prescription coverage, are they currently enrolled in Medicare, what's their Medicare ID number, are you currently enrolled in Medicare Part D plan. And remember, these things don't really matter in terms of eligibility. It's just general information, so Lone Star can do their job better in the back. And then you have the prescribing doctor information. So in this case, you want to get as much information as you can. You can put their name for sure and their phone number. So you at least need to have that, the full name and the phone number. But if you can get the address, that's fantastic. If you can get their fax number, that's fantastic. Now, a lot of people have obviously multiple prescribing doctors for multiple medications. So you have all that right here. You can put 3 right here. And then basically what you're going to do is put in the prescriptions that they have, and you're going to select which doctor is the prescribing physician on that specific medication. Okay, so you have all these here to put in if you have 8 or more. And then additional information, obviously you can just keep submitting more prescriptions if they actually have that many. Draft date for recurring fee. Just so you know, the options to the client are to pay on the 4th every month or the 22nd every month. There's no way to get around that, so you just ask them what's the most convenient for them. Under your payment method, you have a credit card you can select, all your basic information here, or the bank draft here, which can be savings or checking, individual or business account. And then you just go ahead and check that box, and you hit submit order, and you are done with the online submission of new business. It's really that simple. As you can see, the very basic information, nothing complicated. You just hit submit, and you are all done. You will automatically see this in your back office, so it'll be listed there right away, and you're all set with submitting it online. For those of you that prefer a paper application, I went ahead and created one that mirrors the questions for the online application directly. So I made it very easy to follow. This is kind of self-explanatory. It's 2 pages, so I go ahead and print mine front and back. And this is great to bring it to a home. It's also a fillable PDF as well. So if you do want to bring your laptop or tablet to the home, but you don't have internet access, you can also use this as well. So it's just convenient to have a paper application. A lot of people prefer to fill those out. Some people are still old-fashioned in that they just prefer things to be written down as well. I'm talking about clients here. So, you might find it better to have this with you to just fill out with them. Another thing to consider with this as well, let's say that you're in a setting where you're talking to multiple people about this. You could give them the application for them to return to you later. If you have someone on the phone that maybe doesn't feel comfortable with giving information over the phone. Some people don't. They'll give you some things, but they won't, give you your social or give away their credit card information. That's understandable. You could, instead of losing the sale, you can say, oh, well, let me send you a paper application. You can fill that out at your convenience and get it back to me. And for some reason, they feel much more comfortable with that. But I've also created this for that purpose as well. So I've made it. Feel free to use it. And that is the paper application. So marketing, let's go over some basic marketing. There's probably a lot of agents on this call that have done sales for a long time and are used to being independent marketing on their own. So you might know better than myself how you want to market this product. You already have it in mind, and that's fantastic. There's others that have never been independent agents before, and I'm happy to share any kind of marketing ideas that I can come up with. As your upline manager, I'm happy to also give you, any of the marketing materials I've created. I can customize them for you with your information, of course, and send them your way. As far as actually printing any items, that's up to you. I don't have a print shop, so you wouldn't order them from me. All I would do is provide you with the design, and then you can order as many as you'd like. The good news is that it's relatively inexpensive to get lots of things printed these days, so you can have a lot of effective marketing materials on a tight budget. For example, what you're seeing in front of you here, I created. I suppose it could be maybe some kind of a postcard-sized, glossy handout as far as where you would use it. Festivals, lots of people, perhaps a busy parking lot. As long as it gets in the hands of a potential customer, that would be the point of something like this. You can have a local print shop do it up, or Vista Print, and you're going to have 500 or 1,000 of them made minimum, I'm sure. So you want it to look attractive, and you really want to just get it in the hands of people that might be potential clients, basically. Looking at some other examples. Here's a huge banner that I created. Big text, the basics here. Where could you use something like this? If you have perhaps a large flea market in your area, you can rent a table for the weekend for, they usually charge $15, something like that, for the day. So you could have this banner there, very attractive. People will see it and walk over to you. Again, it's all numbers. The more people you talk to, the more sales you're going to get. So this banner also is something you could order off Vistaprint, and I can provide it to you and customize. And maybe you're doing a flea market, you're doing festivals, rent a table for the day there. Anything where there's going to be a lot of people, they're going to see this banner and they're going to approach you, basically. Moving on to something else, business cards, very basic. This design is something you could have ordered on Vistaprint also for pretty much cheap. If you wanted to alter the design on your own, you can. The Lone Star Script Care logo is available to you on their website, or I can email it to you. So here's just a general idea of what a business card could look like. But again, it's up to you. If you want to change it, you certainly can. Let's see what else we have here. Yard signs. So the reason I'm on this website here, yardsignwholesale.com, is because if you want to have yard signs to put out, those are very effective. You get lots of calls from yard signs, lots of calls. Now, a lot of people see these, so not everyone that calls you is, going to be a perfect client. But again, you can order a lot of these, spend less than $200 and get a bunch of phone calls, So, I don't specifically endorse this website myself. It's just I've used them before and they work great. But you might have a local person that can do your signs for you for even cheaper. I don't know. But anyway, yard signs are very effective. It's one of the most basic ways of marketing. So if you are going to do some marketing, when you look at your budget, you might really want to consider making yard signs a part of that. Here's a large yard sign that I kind of created on my own. Very basic. It's a lot like the huge banner you saw before. So it's just an idea. Moving on to this little trifold here. This is perfect. You can edit this yourself in Microsoft Word. You can cut it in 3 pieces. Then you can take that and again, you just can do all kinds of things with it. You can ask doctors if you can have that in their offices. You pass it out. So very simple marketing there, very basic marketing. You just want to get your name out there and your phone number out there. That's really the key. You want people to see that you offer prescriptions for free. Here's your phone number, your email, contact me, and the more you have out there, the more calls you're going to get, and that's basically how marketing works. Keep in mind your centers of influence for marketing, senior homes, assisted living facilities, doctors' offices, other service-based organizations, not just for marketing materials, but when it comes to senior homes and assisted living facilities and your local library, consider hosting an event. See if the coordinator there will allow you to use a room and to have an event where people come and you basically talk to them about this program. Remember, we're a nonprofit, so you can use that to your advantage. Don't do that to sell the product the day of. Let the coordinator of the facility know that this event is strictly informative. You're going to give out the information, and you're just going to show people how to save money on prescriptions. It's all a good thing. So generally, they'll be pretty receptive of that. And the day of the event, have your paper applications, have your business cards, have your contact info. Just give the basics of the program. Let them know how it can help them, how it can save them money, and then set appointments for the week with those folks. If you try to sign them all up then and there, that would first off take a lot of time, and second off, the facility they might not be too happy with you, the fact that you're using it just to make money and sign people up. So it's a great way of marketing. Just do it the right way. Try to stay within the rules. Also, when it comes to co-brands and marketing materials, you can produce marketing materials on your own, your websites, your flyers, your brochures. You're completely free to use their logo. So Lone Star is very lenient on that as well. As you can see, I've created my own marketing materials. You can create your own. If you have talents in that, or you have a friend that can help you with that, then feel free. Lone Star is great about that. They want you to get the word out there. So you're not going to have to worry about getting in trouble as an agent for using their logo. Another idea real quick. Here's a Facebook page I made recently for Lone Star. So you can create one of your own as well. If you have a lot of Facebook friends, I'm not really a Facebook person myself, but if you are, you can share your page with your family and friends on there and promote it that way. Another completely free way of marketing, you can create a Facebook business page for free. It's very easy. You can just Google how to create a Facebook business page, and it's a step-by-step process. So you can do that. It's very, very easy. And of course, I can provide to you, the marketing logo you see there in the back. I can just put your information there if you'd like to use that. Okie doke. Let's go ahead and talk about recruiting. After selling this program for a few weeks, recruitment wasn't really on my mind. I was just excited to share it with people because it's a fantastic program and a great business tool. Plus, it's nationwide, and with me being in Florida, I knew I couldn't heavily market the entire country, so I might as well share, right? With that being said, this is a program I believe in, and I know it's going to be pretty huge. And I feel building a team is a great way to earn extra commissions, but most importantly, a team is going to be necessary to even begin to spread the word about this program to those that truly need it. Let's take a look at the commission schedule as an upline and how it works. Any agent is eligible to recruit for Lone Star Script Care, and you can enroll as many as you'd like to help build your team. For every new enrollment, you will receive a $10 per enrollment override. All right, that's for every agent that's directly under you. So to give an example, if an agent goes out, sells the program, she receives her $25 commission, and you would receive $10 override. Just want to clarify, if this particular salesperson is doing 8 or more per week and getting the $40 per sign up, you would not be receiving any extra override. It would still just be the $10. Okay. Once you've established a downline that is producing a minimum number of weekly new enrollments, you will be paid a monthly commission payment. If the average weekly new enrollments is 25, your monthly payment would be $2,000. If annualized, it would be $24,000, and then that goes right on down the list to 100 enrollments with $8,333 every month, and annualized to 100,000. Of course, there's higher levels available. So let me explain exactly how this works. Let's say you have 10 agents directly under you, and each agent signs up an average of 5 new clients every week. Well, first off, you would receive $500 in enrollment overrides. Okay, and secondly, that would be 50 enrollments to go towards your average weekly new enrollments, and that would give you the $4,166 monthly, $50,000 a year. Now let's say that each one of those agents has an agent underneath them, and they sign up 5 people on average every week. Well, you wouldn't be receiving any more on the enrollment override. However, those 50 go towards your average weekly new enrollments, which puts you at 100, which is the $8,333 monthly, and an annualized commission of $100,000. So as you can see, it doesn't really take a huge team to bring in some pretty significant commissions. Basically, you just need to have a team that is producing. As far as recruiting tactics, I'd say Craigslist is the most popular and effective. You can place an ad for free in most places and get a decent response. You could also tell family and friends and share the opportunity on Facebook and other social media sites. If you know anyone outgoing and likes to talk to people, then this would be a great fit for them. Sales experience is a plus, but in this case, the product does kind of sell itself, and I think there's potential for finding a lot of great agents. Also, don't forget to stress there is no fee to become an agent, and you get your website and back office for free. That will instantly set you apart from the hundreds of fly-by-night scams that are currently out there. As far as being an upline agent, I feel it's important to support your team. The good news is I'm your upline agent, and all the marketing materials I'm happy to share and my custom application are yours to use and share as well. Possibly my biggest contribution to you is this video, as of course people will have lots of questions when they start off. No need to make your own video or explain the program multiple times. Just link them to this one and it's taken care of.